Kids are becoming the latest casualty in the coronavirus pandemic in New York.
We've seen 3 cases at PM Pediatrics with this syndrome, have been very ill appearing, high fevers for several days, GI symptoms like vomiting, diarrhea, belly pain, and rash or swelling.
It's called pediatric multisystem inflammatory syndrome, and it appears to be linked to COVID-19. Dr. Cheryl Cohen helps run clinical operations at PM Pediatrics, which has facilities across the tri-state.
They do test positive for COVID. They generally have a very mild course and then several days later have these more extreme symptoms.
The Care Center for Kids started testing children for COVID-19 in late March and already started testing them for the antibody. So far, they tested over 3,000 kids in New York. 19% of the nasal swabs came back positive for COVID-19, and about 20% of the antibody tests were also positive.
I think we're seeing more kids now than we were at the beginning.
Mayor Bill de Blasio Sunday saying all pediatricians in the city are now required to do antibody testing for kids with symptoms.
We're sending a health alert to the parents of more than 1 million public school kids to put them on alert.
At his daily update Sunday, Governor Andrew Cuomo said 85 kids in New York have been reported sick with the syndrome, including dozens in the New York City area, most of them toddlers and elementary school aged. And sadly, 3 deaths have been confirmed to be related to the syndrome. 2 more are under investigation.
It's possible that these cases were coming in and were not diagnosed as related to COVID because they don't appear as COVID.
It's definitely very scary and sad. What we are seeing, though, is still many children who are doing very well.
And health officials say if your kids have any of these symptoms, call their doctor right away.